Buongiorno. I am a Thai massage instructor, and in this video I will demonstrate some Thai massage techniques on the typical massage table. As you may know, traditional Thai massage is performed on the floor. In this tutorial, we will see how we can perform them on the table. One of the great advantages of traditional Thai massage for the therapist when it is performed on the floor is that he or she is able to utilize his or her body weight for leverage. Thus, a small-sized person is able to work deeply and satisfactorily on a larger client. This is possible because of the 45 degrees axis we put in use when we lean in order to apply pressure. However, when the client lies on the massage table, biomechanics change considerably. The axis of our body weight we are able to deliver towards the client is much smaller. I'd say it's something close to 25 or 30 degrees. This means that we have to modify some techniques. We also have to modify some of our leverages as the setting is different. Thai table massage can be performed on a usual massage table. You do not need a hydraulic table, although it is always an advantage to have one when performing manipulations and mobilizations that call for height adjustments. As for its height, I personally keep it to the height I use for Swedish massage. In order to find the ideal height of the massage table for you, stand next to the table. The table should reach the first knuckle of your index finger. You should lower your table if you're working on a larger client. Another consideration which is often overlooked in traditional Thai massage is the range of motion during the application of the techniques. You should not overdo it, as this may cause harm. Less is more in most of cases. I am going to demonstrate the techniques according to the protocol of traditional Thai massage. That is, I will start in supine position. Then I will proceed to the side position, then to prone position, and finally to the face. I start from the feet and proceed towards the head in all positions. At some points, you will hear me saying that I'm working on the sen lines. This is a process called Jop Sen in Thai and consists of 5 steps. Step 1 is stretching. Step 2 is palm walking. Step 3 is thumb walking on the Thai meridians called Sen. 4 is again palm walking, and 5 is stretching. Now, let's see some techniques of Thai table massage. We will start with the supine position. The supine position is good for leg pain as well as for lower back pain, as it contains stretches for the muscles that support the pelvis. From this position, you can also work on the belly, the chest, and the arms. Start at the feet. Press alternately on the inner arch of the foot. Then do thumb presses on the inner arch. Work on the Kalatari Sen line on the foot. This consists of 5 lines, each ending on a toe. Rotate the feet and then press the feet downwards and upwards. The stretch should be felt on the leg muscles too. Cross the feet and press them. Omit this in osteoporotic women. Work on 6 points on the plantar aspect of each foot. Then, grasp the feet from the heels and shake them. You can also rotate the legs and pull them. Work on the 3 Sen lines of the outer leg. work on the two sand lines of the inner leg. Warm the legs. Start by walking on the lower leg with your palms. Then rotate the knee joint and then do palm walking on the thighs. Return to the feet. Bend the leg and sit on the client's foot in order to lock it. Warm the thighs with this rocking movement. And then lock your fingers and lift the quadriceps muscle. Then press the thigh with your thumbs. Knead the gastrocnemius muscle, stabilizing the leg by placing your hand on the kneecap lightly. Then pull the leg. This decompresses the hip joint. Bend the client's leg and place the foot next to the knee joint. Place your leg on the table and press alternatively on the client's thighs. This is a great technique for the hip joint and the pelvis. You can also press with your forearm. Then press the inner leg with your foot. Yes, you can also go on the table. Place the client's leg on your shoulder and work on the hamstring muscles with your fist. And with your thumbs, and with your forearm. Rotate the leg. Then place her foot above your iliac crest, bend her leg outwards, and place your hand on the inner thigh of the other leg. This is a stretch for the adductor muscles and for the psoas. Stretch her leg and hold it. Perform the stretch gently. Bend the leg and lock it above the knee. Place your leg on the table and push backwards her stretched leg. Respect the body's boundaries. Do fist presses and forearm presses. Place your fingers below the knee joint and do this rocking technique in order to relax the whole leg. Then lift both legs, shake them, and pull them. Rotate the legs and repeat the techniques on the other leg. Place one hand on her shoulder and one hand on thigh and stretch the torso. Avoid putting too much pressure on the shoulder. Do 4 stretches on the torso. Massage the belly. And then do the cup technique. This is a deep massage technique for the organs of the abdominal cavity. Press 6 points on the belly, next to the rectus abdominis muscle. Press 9 points around the belly. These correspond to the Nantakavat Sen. Shake the torso. And massage the torso. Then lift the torso with one hand and press the thigh with your other hand. This is a good technique for the pelvis. Have the patient cross her arms. And cross her legs. Place your hand on the iliac crest and pull the client's torso. This technique stretches the quadratus lumborum. Grasp her arm and place your hand on the iliac crest. Pull the arm while holding the iliac crest. This technique targets the thoracic spine. Then work on the arm, doing Japsen. This is the Ita and Pingala Sen line. Work on the inner part of the arm, doing Japsen. This is the Kalatari Sen line. Bend the arm, place it on your thigh and work around the elbow. Then place the arm in the triangle position and stretch the torso. This is also a good position to work on the triceps muscle. From this position, you can grasp and pull the ribs, creating space in the thoracic cage. Grasp the arms and ask the client to interlock her fingers behind your back. Then push her pectoralis major muscle while pulling your body backwards. This technique also creates space in the thoracic cage. Repeat the techniques on the arm from the other side as well. grasp the arm and place your foot on the ribs below the breast and stretch. Place her hand on your thigh and massage the palm. Also, massage the dorsal side of the hand. Grasp the arm and hit it on the table. This releases the shoulder. Then grasp the arm and shake it. Interlock your fingers on the palm and stretch the inner arm. Sit on the table and place your foot in the armpit. Stretch the arm. Take care not to push your foot in the armpit. Push lightly the shoulders in order to create space in the thoracic cage. Do acupressure on the sternum. These points are good for breathing problems. This is the Sumana Sen line. Push again lightly the shoulders in order to conclude this part of the session. Now, we'll see techniques for the side position. This is the most important position, as it allows us to access the whole body. If you are trained in pregnancy massage, you can perform some of these techniques on a pregnant woman as well, with the appropriate adjustments in her positioning. Start by doing Japsen on the lines of the inner leg. Work on the foot. And do butterfly presses on the inner leg. Work on the iliotibial band with your forearm. And press lightly the lower leg. Place your forearm on the gluteus muscle and direct your massage technique towards her feet in order to decompress the lumbar spine. Then stretch the back. The center of your palm should be on the spinous processes of the vertebrae. Do palm walking on the back. Do deep tissue work next to the vertebrae. pulling upwards the back muscles with your thumbs. Rotate the shoulder gently. Place your hand on the mastoid process and stretch very gently. Massage the shoulder and insert your fingers next to the scapula while pushing towards yourself the shoulder. Raise and stretch the arm while pressing lightly on the ribs. Put her arm behind your back and place your forearm next to the hip joint. Push the hip joint forwards, taking care not to put pressure on the shoulder. This targets the lower lumbar vertebrae. Then stretch the arm and do Japsen work on the outer arm. Work on the palm as well. Place the arm in the triangle position and stretch the torso. Start opening the ribs, thus creating space in the thoracic cage. Stretch the arm. The palm should face the client's head. And massage the deltoid muscle. Cross your arm for leverage and do a stretch for the lower back. Bend the client's legs and place them on your belly. Start mobilizing them and then create a stretch on the lower back with your arms. Grasp the patella and stretch the leg. You can do a similar stretch on the other leg as well. This concludes the side position. Now we will see techniques for the prone position. Very often, this is the most pleasant position for the client. as it allows the therapist to work on the back with direct pressure. Prone position can be uncomfortable though for some people with lower back issues. In that case, you should focus on work in the side position. Start at the feet. Press the Kalatari Sen lines of the feet. Massage the heel and the center of the foot with your fists. Do palm walking on the Ita and Pingala Sen at the posterior side of the legs. Then do thumb walking on the lines and then palm walking again. Bend the leg and rotate the foot joint. Work on the popliteal space with your thumbs, very gently. Then stretch the popliteal area. Massage the calf muscles. Press the posterior thigh muscles with your fist while pushing the lower leg. Lift the leg by holding it from the patella and stabilize the lower back with your palm. Lock the leg in the other leg's knee joint and do fist presses while pushing the other leg towards the client's head. You can also work with your thumbs. Lift the legs and stabilize the lower back with your palm. Grasp the leg. And rotate it slightly inwards. While pushing on the lumbar spine upwards. This decompresses the lower back. Shake the leg. Cross the feet and push them towards the client's sacrum. Do not overdo it. Now we will work on the back. Begin with stretches. Use your forearms. Then do palm walking. Proceed with thumb walking. Do again palm walking. And repeat the stretches with your forearms. Stretch the spine and the lower back. You can go again over some points that need attention, especially on the lower back. You can also work on the shoulders. And repeat the stretches. Bend the arm and place it on the back. This is a good position for work on the deltoid muscle and the rhomboid muscles around the scapula. Place your hand below the shoulder and the fingers of your other hand next to the scapula. Lift the shoulder while doing finger presses next to the scapula. You can work with your elbow. And work on the teres major muscle. Hold the shoulder and pull it while pushing gently the head from the occipital bone. Do some tapping and massage the shoulders. Pull the head in order to decompress the neck. And pull gently the occipital bone while pushing gently the spine towards the feet. Ask the client to interlock her fingers behind her head and place your hands on the thoracic spine. Lift the torso. You can also rotate and stretch gently the torso. Ask the client to lay one arm on the other as shown. Grasp her arms with one hand and with the other hand work on the thoracic spine. You can also rotate the torso in order to unblock the thoracic spine. This concludes the prone position. I always conclude the session with face massage, as this leaves the client deeply relaxed. In this tutorial, I'm working on Thai acupressure points, which are excellent for headaches and screen stress. Start by pushing down the shoulders. Work alternatively and gently. Slide your hand on the neck, gently pulling the head. Turn the head and place your hand next to the ear. With your other hand, push the shoulder towards the feet. Repeat on the other side. Take care not to push the head in this technique. Push only the shoulder. Grasp the atlanto-occipital joint and pull the head. Cross your arms behind the client's neck and lift her head while pressing gently the shoulders. Work on the forehead, sliding your fingers gently but firmly. This is a good technique for sinusitis and headaches. Place your thumbs below the lips and your index fingers above the lips and pull the face. Then slide your thumbs on the forehead. Press 3 points from the root of the nose up to the hairline. Press 3 points right below the hairline. And then rub the temples. Pinch the eyebrows. The first point targets the corrugator supercilii muscle. Cover the ears, make a half circle, push gently and release. Cover the ear, make a half circle and tap gently your hand. Shampoo the scalp. This is good for headaches. Rub your fingers on the atlanto-occipital joint. This is also good for headaches. Massage the earlobe. Grasp the atlanto-occipital joint and with your other hand pull the head. This concludes the face techniques. Thank you for watching this video. I hope it will be useful for your practice. If you liked it, please leave a review on Amazon and IMDb. Check out my other books and videos on Amazon as well. Keep in mind that they are all independent, low-budget productions. Be sure to visit my website, jointheflow.net. There, you will see my blog and learn more about my courses, which are taught in Greek and English. Pleasant journeys. Thank you.